One of the concerns as a leader of my community and the culture of health is minority females in the executive leadership role, especially in healthcare. We are now seeing a high increment increase in minorities in the community-based hospitals with chronic comorbids, suffering with diabetes, hypertension, cardiac disease, prostate cancer, etc. And a lot of the issues that I'm finding as I continue to go down my own career path is that there is such a absence of minority level, executive level leaders in these roles in the executive suite in the hospital organizations. We have decision makers that are making decisions in these hospital based settings on how we're going to not only create community based programming to help deal with these chronic comorbids and dealing with family centered, patient centered care and case management, but we're also coming up with decisions on future practices. And I think it's ideal and almost necessary to ensure that we have the minority female face in those seats, being able to add the necessary changes that we need for that particular demographic, because all demographics need a necessity and representation. We As I've been continuously doing my research and going out into the community, I've identified that, a lot of young females, whether in college institutions or in high schools, are being geared and structured to, yes, graduate from high school, go into college, graduate from college, get a job, even a decent job, but very rarely is that excessive push or at least that conversation to stimulate the mind process to understand the importance of not only being able to be either a pioneer or a trailblazer to start inhabiting some of those roles, but to in essence become the change that they want to see. If you don't see an individual in that role, take that role on. And I want to encompass enlightening, empowering, evolving, and eventually executing an academy within the institutions of high schools and colleges, and speaking to young minority females so that way they understand that we are all in this together.